8:15 as we continue with Johnson County Today. In the studio with us now, Darinda, CEO and President at Western Missouri Medical Center, along with Dr. David Glover. Hello.
Good morning.
Good morning, Woody.
How you doing, Dave?
I'm great. How
I
are
haven't
you
seen
doing?
you in a while.
Well, you know, I haven't been here in a while, but I'm back.
Oh, you're back. Darinda, I see every once in a while.
Right?
We have things to talk about today of importance, I think.
Absolutely. I think that I wanted to bring Dr. Glover because I think that he has been a real leader in our community around our preparation and treatment of COVID patients. And so I want to make sure that everybody's well informed about what's going on in our county and then how we're responding from the healthcare side.
Yeah, I have a question for Dr. Glover, and he might be able to answer this. Why are so many people reluctant to get the vaccination?
Yeah, Woody, I have a hard time understanding it myself. I think in the beginning it was politicized a great deal, and
Yeah.
I think because of that, people think of it politically as opposed to scientifically or as opposed to medically. I mean, it's a medical issue, it's not a political issue. It should have been that way from the beginning, and I think it's had a bad start from that standpoint. And then, of course, the explosion of media that you can just dial into your phone, where it feeds you what you want to hear, I think gives a lot of misrepresentation to people as well. So I think a combination of things have led to poor vaccination rates in our county and elsewhere.
Is this taking up a lot of your time?
Well, it's certainly taken up some. There have been times during the last year when I've spent a tremendous amount of time dealing with this whole issue, trying to make us as healthy as possible and help our community get through this. And now we're starting to see more cases again, and it's quite concerning.
Is it beginning to really show up in the last few days, or is this just continuing from where it's been?
No, our positivity rate is up in the county. We're not anywhere near our high, either by hospitalized or obviously total number, not even near for the county. However, given some of the other experiences in Missouri, I think people are just concerned at how quickly they got to where they were at their high last year, as far as hospitalizations go. And so we have 6 people hospitalized right now with it, which is an increase from what we had been doing. We had never stopped having hospitalized COVID patients through any of this, but we had gotten fairly low. And so, we are starting to trend upwards a little bit, but our total numbers obviously are still very low relatively compared to some of the numbers that we saw in the last year.
Some parts of the state, though, are a little scary. I guess around Springfield, Joplin area, and also in, I think it's northeast Missouri as well. Is that because they haven't vaccinated as many as other parts of the state? Or is it just, Doctor, maybe you?
Well, I think that's a combination thing. I think if you look at it, the surrounding areas in the hospitals that have been really hit hard have very low vaccination rates. I think that's part of the equation, Woody. I think one of the other things is that in rural Missouri, because we're geographically more distanced, we may not have had as higher rates of COVID earlier in the fall when some of the more urban areas had much higher percentages of people get sick. So we have less natural immunity in those areas as well. So the combination of low vaccination rates along with a lack of natural immunity in those communities make them highly susceptible. And then of course the Delta variant vaccine, or the Delta variant virus that's out there right now is more contagious, probably 200% more contagious than the original COVID.
Yeah.
And it's also leading to a higher rate of hospitalization as well. So I think there's a lot of factors that go into that, but certainly low vaccination rates a primary consideration.
Does this variant make people more sick?
It does. They end up in the hospital twice as often as people who had the original.
What's the longest you've had anybody in the hospital here?
I really don't have that answer, but I mean, it's probably 3+ weeks.
I saw on television the other night with somebody who was 156 days.
Lucky to have made it that long.
Yes. Yeah, they're still okay. Well, they're not okay, but they're still there. Well, what is it about this COVID-19 that causes that kind of illness? Is it strictly your respiratory system?
No, I mean, that is certainly the primary thing where it hits first. The respiratory system, it can cause severe damage to the lungs. It can also cause clots that occur in various locations, the heart, the brain, the lungs, and then a number of other problems that can occur as well, neurologic sequences. I mean, there's what we know is that COVID has a long list of complications that occur in people who've had COVID. I mean, your risk of getting long-term effects from that is significant. And some people, as you know, just keep piling from one thing to the next. They end up with a severe respiratory thing, and then they get their kidneys involved, their heart involved, they have a pulmonary embolism or a heart attack or whatever it is, or it just destroys their lungs sometimes, and they end up needing their lung transplant. Well, you know, we get to that point, your chances of surviving is very small.
Yeah.
That's why 600,000 people died of it last year.
Wow. Are you changing any of your routine?
Absolutely, and I definitely wanted to talk about that today. And I want to talk about, I know that, you know, we just described it as a pretty gloomy situation in regards to what COVID does to you. But I really want to make sure that we touch on that vaccinated is still the way to go. You still have a much less chance, and Dr. Glover can definitely expand on that. But it is still the recommendation in order to decrease your chance of contracting this is to be vaccinated. So that still is our huge push. We do need to get our numbers up in the county. And the CDC guidelines haven't changed as far as like masking and social distancing around, particularly with our rates in this county. However, and that's why we're not wearing ours. I just want to be clear about that because we're being videoed.
Yeah.
But because we are all vaccinated. But in the hospital, it is still the recommendation, it's not the recommendation, it is the requirement that we are masked in all healthcare facilities. And because there is a higher risk, obviously, if seeing sick people and people that think they have allergies, but they may have COVID and they don't know it, that happens very frequently. So if you're coming to seek healthcare in our system, I just really want to encourage people, you know, be gracious. We're handing out masks, you know, but you have to wear them. So if you're going to enter our system, you're going to be required to wear a mask. We're not changing our visitor policies, you know, right now. We're not at that point. So we're still allowing people to visit their loved ones, but you have to wear a mask. Now that's in the hospital setting and when you enter our building. And so, you know, we've had a lot of resistance. People are like, I'm vaccinated, I don't need to, or it's over. But we are not, that's not the requirement for us. Even when we're vaccinated, we have to wear our mask in a healthcare facility.
So you've never quit wearing them at the hospital?
No.
Oh, okay.
Now, when we have allowed people, like if they're alone at their desk or they're, you know, with no way going to come in contact with somebody within 6 feet and they're vaccinated, then they slip their mask off. I think that causes some confusion because patients come in and they say, well, she didn't have her mask on. Well, she's sitting behind a plastic partition, no one's near her, and when you enter, she's putting her mask on. And so that it just causes a lot of disruption when people don't want to follow the rules, and we're trying really hard not to do what we did last year. We don't want to close down. We don't want people putting off health care. We know what we're doing this year. You know, we know what we're doing. We know what to do, but wearing the mask is the most important thing, and we can't allow people to come in the facility without the mask. So please, be, you know, cooperative with that. Now, in the clinic setting, more people arrive that don't really think they're sick, but they have allergies.
Yeah.
I'll put it in air quotes. And then we've had some people end up, you know, that are positive for COVID. So we are going to go back to our practice of calling from the parking lot. You know, we'll escort you in. Again, you have to wear your mask. But we're just trying to keep everybody safe. My entire intention through this entire pandemic has been to keep employees safe, because if we can keep employees safe in every business, then we can keep taking care of people. We can keep whatever our business is. But for us, we have to be able to keep our employees healthy and, you know, continue to come to work so we can take care of patients. But we also don't want to risk patient-to-patient spread, obviously, and in the clinics that's more likely. Because of the waiting room situation. So we will be changing that. That will be coming rather swiftly.
Like today, maybe?
That's the plan. But again, not to cause panic, but really just to make sure we're being as safe as we can be, because we don't want to be Springfield. You know, we do have we have a very low vaccination percentage rate here, and it's been disappointing because it felt like we were all around, you know, behind it.
Yeah.
But the numbers don't lie, apparently. We've tried to make up all kinds of reasons why they are not right, but I think we are a lowly vaccinated county, so we.
We're
puts us
one
at
of the
risk.
lowest at 21.7% is the last number I saw.
Yes.
And I've only seen one county lower, and that was 20% somewhere, I forget where it was. Another one at 21.7, so we're way down there.
Yes.
How do we fix that? Doc, you got any idea how to fix that?
Well, first of all, let's be clear about a couple of things, okay?
Okay.
About the vaccine. Let's talk about some facts about the vaccines.
Okay.
They are effective and they are safe. Even with the Delta variant, 80% of the people who are going to get COVID will not get it if they've been vaccinated. And if they've been vaccinated, your chance of being hospitalized is reduced by over 90%. So if you get it, you're going to get it milder, and you're much less likely to get it. So the idea that, well, you can still get it, yeah, you can still get it with any of them, but the odds are greatly with you.
Yeah.
You're not going to get it if you've been vaccinated. So first of all, vaccines work. Second thing is they are exceedingly safe. Are there potential problems you can see with them? Sure. There's about 2 to 5 people per million that have anaphylactic reactions and can have severe allergic reactions when you take them. We know that there's a possibility of getting a inflammation of the heart with certain vaccines in a very small number of people. But if you look at the statistics on myocarditis with the vaccine, we maybe see 30 to 50 people per million who get that, which is a pretty small number.
Yeah, it is.
So if you vaccinate 1 million people, you end up with 30 to 50 cases of myocarditis. Well, this is not a virally infected heart. So for all our Google physicians out there, you can't look up myocarditis and extrapolate that. This is a mild condition that typically goes away within 1 to 2 weeks and doesn't require hospitalization, okay? 30 to 50 cases of that. Now, if you don't vaccinate that same group, 5,000 will come down with COVID, 200 of them will be hospitalized, 50 of them will end up in the ICU, and 2 of them will die. And that's of people who are 17 years to 25 years of age. So this is young, healthy people, which are the ones that typically get this. So when you look at the facts, although you can blow them out of proportion in a lot of ways, the fact is you can go with a relatively self-limited mild problem that occurs 30 to 50 times in 1 million people, or you can be taking the risk of having hospitalization, ICU admission, and death without the vaccine. So that is really not a big issue. The only one that's really a serious concern for me is also extremely rare, 1 to 2 people probably per million, and that's the clotting in the brain that can occur. And that's usually in females, less than 50. But that's the serious one. That one's a real deal, and I think that one really is an issue. It's extremely rare. Your chance of dying from COVID, again, is much higher than your chance of getting sick from the vaccine. So the vaccination is extremely safe, it's extremely effective, and that's first. Now let's go to the other issue of our county's response. I'm pretty disappointed. You know, I always think of us as a pretty caring community where we look after each other and we take care of each other, and we're just simply not doing it. The reason to get a vaccine partially is for yourself, Woody, but a lot of times it's for the guy next to you. It's for the person who can't be vaccinated. It's for the person, for the child who can't be vaccinated at this point. For the older adult whose vaccine maybe didn't work right because their immune system's not very good. It's for the other people around us. That's another reason we're doing it. I mean, it's not just for you. It's for everybody else in the community. And that's the thing that really concerns me the most about this. It's really very disappointing because that's not the kind of community we typically are. We usually take care of each other quite well.
Yes, we do, and I agree with everything you said there too, about protecting family and friends.
Yeah.
Yeah. Anything else, Darinda?
Well, where you get a vaccination now, if you've been a late adopter, there still are, obviously, they're widely available. You know, every pharmacy in town, Walmart, they practically follow you around at a lot of Walmarts I've been to.
Yeah.
The hospital does, if you see your physician and you're wanting it, we can't give it that day in the clinic because, again, there's a lot of restrictions around mixing it and having it frozen and refrigerated, those kinds of things. However, every Friday we're giving those really based on appointment, you make an appointment. It's not as easy as just going to
Yeah.
Summers.
Community Health did, I
Community
think,
Health does-
38 yesterday, I believe
Correct.
she told me a while ago.
So those are the two that we're kind of putting on our flyers is what we're doing and what Community Health is doing, but a lot of other people have it available here in this community. And so we really, really want to encourage people. We are going to start offering it to every patient that comes through the emergency department as just a place to, have you just not wanted to, but now you might. So when they are in the emergency department, we are going to offer it to them.
Make it more available.
Yep, and then they would have a chance to come back and get their second at our regular clinic.
Yeah.
But we're really trying to make sure that we are getting to the people that may have been hesitant to take the vaccine.
Thank you, folks, for taking your time to come visit with me today about this. I know it's very important. I've been trying to stress it here as best I can without getting in people's faces about it, but we need to do this.
It's never too late to do the right thing.
Right. Thank you, Dr. Lever. Good to see you.
Nice seeing you.
Darinda, thanks for coming today.
Thanks, Woody.